Hey y'all, I hope y'all enjoy these extra episodes this week. The reason I'm doing this is because on September 24th, the Nashville chapter of the JDRF, which is the Juvenile Diabetes Research Foundation, is having their annual One Walk. And friend of the show, Rachel Mayo, who has been type 1 diabetic for over 10 years now, is trying to raise money for her team to take to the One Walk. Her goal for this year is for her team to raise $5,000. And last year, I actually took my body and my baby and we went to the One Walk, and I got to walk with her team and hang out with them. This year, I'm not able to do that, but I still want to help. And so I am using these special episodes to help promote her team and help her reach her goal. If you want to donate, the link to her team page will be in the show notes of this episode. It is also in the pinned post on the podcast Facebook page. That's facebook.com/farmanswerspod. So the link is there. You can click it. You can see the picture. You can actually see me and my baby as we posed for our team picture at the walk last year. She met her goal last year with flying colors, and this year I want her to do the same. So $1, $5, it doesn't matter what amount. Any amount helps. Thanks so much for listening. Thanks so much for your support, and thank you for supporting Rachel and the JDRF and the research to help end type 1 diabetes.
Nothing you're about to hear should be taken as or used in place of medical advice. If you resemble anything you hear, contact your doctor. If you want to know what Walgreens thinks, ask them, because we don't know. Please wait behind the line for privacy.
You're listening to the Pharmacist Answers podcast. I'm Cynthia, the pharmacist, and today you'll get your questions answered and your curiosity cured. So the thing that we're going to talk about today is how medication affects blood sugar. People who suffer with chronic diseases don't get holidays from their medication. Holidays come up, still got to take your medicine. Vacations come around, still got to take your medication. So those are things, even though the holidays are fun and festive and everything's supposed to be as carefree and joyful as possible, medication is still on the front of the brain for most people with chronic diseases, including people with diabetes. And I'm talking specifically about diabetes because November is National Diabetes Awareness Month. There's 4 instances in which medication can affect blood sugar. One is the type of medication, the timing of the medication, the actual dose of the medication, and then the 4th one is interactions with medication. So the type of medication, obviously for people with diabetes, the medication that they take is to help keep their blood sugar low in a safe and healthy range so the sugar doesn't just wreak havoc on their body. Too much sugar can lead to damage to organs. It can lead to damage to your brain, which leads to comas and all kinds of things. We don't want that to happen. So the type of medication that people with diabetes have to take, its number one goal is to keep the blood sugar in the normal range. So for people who take insulin, insulin directly affects the blood sugar. That's insulin's job. That's insulin's job for those of us without diabetes. When our body is making the natural insulin, its job is to control the blood sugar. So for diabetics, either their insulin factory is broken and it's not making insulin anymore, so they have to get insulin from somewhere else. Thus, it comes in a little vial that either goes in a machine or goes in a syringe and they have to inject it. Or 2, the mechanism in their body to use the insulin. I always describe insulin as a key, and all of your cells have a door. So if the key is broken or the door is broken, then it's not going to unlock and let the sugar in. That's type 2 diabetes. And sometimes those patients have to take insulin because their insulin is so broken that they need fresh insulin because their insulin isn't repairable by any other medication that's like pill. Or their doors are so broken that they need something else to try to fix their doors. There's certain medications for type 2 diabetes that, one, push the pancreas that's making a little bit of insulin to try to make more. So it tries to stimulate insulin production from the factory that's still kind of there but about to burn out. Other medications for type 2 diabetes will affect the door and try to get the cells to be more sensitive to fix that lock and key so the insulin that is there can unlock it and get it in. So there are certain medications that type 2 diabetics will take that directly affect insulin, but it's not actual insulin. And then the other type of medication, and I had an interesting conversation about this medication with a patient the other day, but it's called Metformin. And it's usually the medication that type 2 diabetics are started on to begin with because it does not directly affect blood sugar. Metformin, I described it to her, and this is like a 65-year-old lady. When I gave her this analogy, she laughed out loud in my pharmacy waiting area. Everybody heard her, but it obviously clicked in her brain. But metformin is like insulin's wingman. While some of the pills that type 2 diabetics will take directly affect the insulin production or the insulin sensitivity, metformin is the guy that runs around and says, oh, hey, insulin, let me clean off this door for you right fast so you can unlock it. And so it's the wingman of insulin to make sure if insulin is headed somewhere, it's going to make sure that the interaction that insulin has with that thing is going to go as smooth as possible. So if there's no sugar floating around and not a lot of insulin being made, then metformin is just like hanging out, waiting on my pal insulin. So if you take metformin and you don't eat, then you're not going to have a blood sugar drop, where some other pills for type 2 diabetes or insulin specifically, if you take it and you don't eat, then your blood sugar is going to drop because it's going to do its job. It's almost like they're smart, but there's like a certain interaction that they're going to have that as things are floating by them in your bloodstream, if it's not clicking in the right spot, then they're just going to hang out there until something makes that connection, and then it'll do exactly what it's supposed to do. So that's the types of medications that you take can affect blood sugar. So for all of these meals that we're going to be eating, medication has to be timed right. So medication has to be taken with food, and if you're not going to be having food at a specific time, then you have to skip your medicine. Other medicine, you're not supposed to skip no matter what. And then that also leads into the timing of the medication. Some medication has to be taken around food. So if you eat, you take the medicine. If you don't eat, you skip the medicine. That's true with insulin boluses. Some people will take the insulin like right before you eat or right after you eat. So then it's there to work with all the sugars that you just consumed and your body's going to be digesting. And that's the same with pills for type 2 diabetes. If the goal of the pill is to increase insulin production, then you don't want to increase your insulin production unless you're going to have food and sugars for that insulin to work on. So the timing of the medication is important. And then something that is a little obvious is the dose of the medication. The more medicine that you take, the bigger the impact it's going to be. So the more insulin that you have to inject, then the bigger the blood sugar drop is going to be. So the more sugar you eat, the more insulin you need. That's kind of obvious. The difference for type 2 diabetics that have to take pills, the difference in a half a pill and a whole pill can be the difference between having a good blood sugar and a really low blood sugar. The dose is directly related. Low blood sugar, just any sugar, doesn't work for me. Well, your body's main type of sugar that it uses most efficiently is glucose. That's why everything related to diabetes, you'll hear blood glucose, glucose levels, all of this stuff. If you consume a complex sugar that the body has to work really hard to turn into glucose, then it's not going to improve your hypoglycemia fast enough. So simple sugars, the body can turn into glucose faster and with a smaller amount of energy and work required. So then it's going to become glucose and go to all the places that it needs to go faster, if that kind of makes sense. Simply orange. Orange juice is a number one go-to for anyone who deals with fluctuating blood sugars, whether it's for hypoglycemia or diabetics who deal with that. Because diabetics are just as at risk of their blood sugar falling really low because of something in their body changed, something about their stress level changed, something their medication did. Their medication seemed to work really, really good and it dropped their sugar too low. They're not just at risk for high blood sugars, but they're also at risk for low blood sugars. And orange juice is one of the #1 things on the list to treat hypoglycemia, because the orange juice concentrate is so full of those simple fruit sugars that the body can turn them into glucose in just a split second. And then the body can get that blood sugar back up to get you out of that dangerous level. Your mom was an insulin diabetic. So was she actually type 1 diabetic, or was she insulin dependent type 2? Because that's a differentiation that a lot of the public, Rachel, love my OJ. Yeah, so orange juice is good. And it's certainly got more vitamin stuff for you than like regular soda. That's like the other thing on the list is like drink regular Coke and not Diet Coke, because the Diet Coke has the fake NutraSweet sugar in it, and it's not real sugar, so that's not going to raise your blood sugar fast enough, if much at all. So orange juice is always my #1 recommendation. Regular Coke if you have to. And then there's some explanations of like hard candy, like chewing up hard candy. I mean, and you can always buy like the $2 tube of like the glucose tablets that's straight up glucose. It looks like a Tums tablet, but it's glucose. Friend with pump drinks Diet Coke. Diet Coke is usually not a really good rescue product for low blood sugar. In Coke, which is the best for this. For people who don't live in the South, it would be regular soda. So it could be cola soda or lemon lime soda or orange soda, but it needs to be the regular. It doesn't need to be the diet, because diet sodas contain the NutraSweet, or like those artificial sweeteners. The artificial sweeteners will not rescue you from a really low blood sugar fast enough. Pop in the north. Yeah, so like everything's Coke. Like, I want a Coke. Okay, what kind of Coke? But on a regular basis, I'm not going to judge you for your habits. If you drink regular Mountain Dew and then you can control it with your insulin shots or your pump calculations, then cool, whatever. The goal is just making sure it's controlled. So that's kind of off topic, but the amount of medication directly affects how far down the blood sugar goes. And so if the medicine doesn't match what you eat and you end up too far, then you have to take something to kind of rescue it, because high blood sugar causes coma, low blood sugar causes coma. Coma is bad. Coma is bad. No comas. And then the fourth area that involves medication that can affect blood sugar is medication interactions. So people with chronic diseases, and especially diabetes, still get sick. So sickness in itself can affect blood sugars in like that's a whole nother monster. We may talk about that on a different day. But the medications that you may have to take to feel better or get over an infection or a sickness can also affect blood sugar. There is a certain group of antibiotics. They're called the fluoroquinolones. One of the things that they are notorious for diabetics is, for whatever reason, when they're in the body with other medications that affect blood sugar, it's like the body becomes really sensitive to the things that affect the blood sugar, and the blood sugar can drop a lot faster. They don't know exactly all of the ins and outs and how the puzzle pieces fit together for that to work. They just know when we give these antibiotics to somebody who is also on medication for diabetes, whether it's injections or pills, their blood sugar control just seems to go out the window, and it just gets wacky. They'll get really low and then they'll get really high, and there's no explanation. So we always have to warn, if you take this medication, you may have to check your blood sugar more often, or if you notice symptoms of high or low blood sugars more sporadically, make sure you're checking your blood sugar, make sure you're adjusting your medicine. Steroids are another one that just make blood sugar go wonky and out the wazoo. Steroids affect all kinds of different processes in your body, and this is another one of those things where they don't know how all the puzzle pieces fit together, because they don't even know exactly how steroids do their job, other than the fact that they mimic some of the natural steroid hormones that your body produces. But the steroid pills do the same thing. You'll end up having really high blood sugar, you'll end up having really low blood sugar, and there'll just be a lot of janky stuff going on. And so we always have to, again, warn people, if you notice any weirdness, check your blood sugar more often, because you don't want to end up with too high, you don't want to end up with too low. And there's even been instances where someone who has to use steroids for a chronic reason, whether they've got an autoinflammatory disease like rheumatoid arthritis or Crohn's disease or irritable bowel disease, where they're on long-term steroids, that the steroids cause them to develop type 2 diabetes. There's no explanation, like their body weight and all of those things is better, but their body sensitivity to the insulin controlling the sugar isn't able to do its job, so then they end up having to go on medication for diabetes. So steroids can really jack with blood sugars, whether it's acute steroid treatment for like an infection or an injury, or long-term, whether for like an inflammatory disease. And then the third one that a lot of people use are beta blockers, which is a blood pressure medication. And the warning we always give with beta blockers for blood pressure is that blood pressure medications can mask the symptoms of hypoglycemia. Most likely people have had low blood sugar more often than they've had low blood pressure. But if you think about how you felt when you had low blood sugar, that's the exact same way you feel when you have low blood pressure. So if you just start feeling that way and you are taking things for your blood sugar and you're taking things for your blood pressure, how are you going to know which one's making you feel that way unless you test your blood sugar and your blood pressure? Most people with diabetes have tools to be able to test their blood sugar at home. That's cool. Not everyone who is on blood pressure medication has a tool at home to test their blood pressure at home. They usually have to seek out a medical professional. So people who are on medication for blood pressure and blood sugar, we have to warn them, especially about beta blockers, that if you start feeling that weird feeling that you get when your blood sugar gets too low, don't automatically assume it's your blood sugar, because it could be your blood pressure. And vice versa. Don't automatically just assume that your blood pressure is too low. It could be your blood sugar. So you always have to check. It's the holidays. Who wants to be thinking about that stuff when it's the holidays and we're about to just eat our faces off tomorrow with all the food and stuff for the Thanksgiving holiday? But people with diabetes have to think about these things. And people with other chronic diseases have to think about these things. It's never off their mind, no matter how excited we are about the holidays coming around. So for people who have diabetes, this is the kinds of things that they have to be educated about. For those of us who don't have diabetes, we also need to be educated about these things. Knowing these things allows us to extend grace to our friends who do have diabetes, to know that the holidays aren't as carefree for them as it is for us. That's the 4 areas that medication can affect your blood sugar.
Thanks for listening to the Pharmacist Answers podcast. The pharmacy is now closed. You can post your questions and comments on our Facebook page. That's facebook.com/pharmanswerspod. Or you can email the show at pharmacistanswershere@gmail.com. You can tweet me or message me on Twitter at @SinHendrix. You can find the show notes at pharmacistanswershere.wordpress.com. Pharmacist Answers broadcasts live on Monday, Wednesday, and Thursday at 9:02 a.m. Eastern Time on the Periscope app. You can follow me at SinHendrix or view in your web browser at periscope.tv/SinHendrix. See you next time on the Pharmacist Answers podcast.